Thanks for tuning in. I'm Dr. Donald DeFabio. Chiropractic is a form of healthcare today, and it's a choice you have to use for your healthcare needs. Now, why would you want to choose chiropractic? Well, first of all, it is true healthcare because it works about restoring the natural healing powers of the body, and it's truly about the body as a whole and not just treating the sickness or disease. So it is true healthcare. In fact, if we look at the definition of health out of Dorland's Medical Dictionary, it's optimum physical, mental, emotional well-being, not merely the absence of disease and infirmity. And that's what chiropractic is all about, giving you optimum function of the whole body. It's truly holistic, not just treating the symptoms or the disease process. When you present yourself to a chiropractic office, the doctor is concerned about treating you as a person with a problem as opposed to a problem that happened to find a person. So considering that chiropractic is all about health, what else do you need to know about it? Well, let's look at the history of chiropractic. In 1895, the first chiropractic adjustment was delivered by D.D. Palmer in Davenport, Iowa, on the janitor in his building, who had mentioned he'd lost his hearing after he felt a pop in his back while changing a wagon wheel. D.D. Palmer worked on his back, and after 1 to 3 sessions, we're not exactly sure, Harvey Lillard's hearing returned. It got better. D.D. Palmer thought he found the cause of deafness, but in reality didn't. He found that the spine is integrally related to how the body functions. Well, how can that be? Well, let's think about it. The body is composed of various systems: digestive, respiratory, circulatory, muscular. All these different systems have one thing in common. They're all related to the nerves. The nervous system is the governing system of the body. Look at this picture here. Those are all the nerves in the body. They go everywhere. They go to all your organs, all your muscles. They go everywhere. So when the nervous system is out of balance, the rest of the body is also going to be out of balance. So that's really the governing variable. Do you realize that there's only 12 nerves in your body that go directly from your brain to your eyes, ears, nose, and mouth that don't come out of your spine? Every other nerve in your body, except for those 12, have to come out of your spine at one point or another. Therefore, if your spine has any imbalances, if there's any tightness, if there's any extra movement, if there's any loss of movement, if there's any injury or irritation to the nerves or the discs or the ligaments around the spine, it's going to impact how that area of the spine functions, how those nerves function. And again, look at this chart. It's where the nerves then go to the organs, which then impact your overall health. So when chiropractic doctors talk about healthcare, that's really what we're all about, is looking at how your body functions to restore health, wellness, balance, or the big word is homeostasis within your body. Very simple, but very powerful. And the other really interesting thing about it, it's safe, it doesn't involve medication, it doesn't involve surgery. So that's where chiropractic came from. Now, where is it going? Well, it's continued to evolve. We found that over years that chiropractic was essentially very, very effective for neuromusculoskeletal complaints. Things like back pain, neck pain, headaches, sports injuries. Really, really great for that. However, we're also noticing that by improving the nerve flow to the organs also heal. My great-grandmother in 1921 was told to go home and put her affairs in order because she had pleurisy. And medical doctors at the time couldn't help her. What did she do? She went to a chiropractic doctor and she got well. Does that mean it was the cause of her pleurisy? No, but it stimulated the body enough so that it could heal. We also are going to look at nutrition today. We're also going to look at diet. We're also going to look at lifestyle factors. So there's a lot of layers to what modern chiropractic is all about, and we're going to be talking about that later on in the show. But what you want to look at right now is that chiropractic is true healthcare, which is designed to help your body restore any health or dysfunction that's lost, get back your active lifestyle that you're looking for without medication, without surgery, and embracing a lifestyle of change. Pretty interesting, very exciting for me. I don't think I could be any happier and exciting doing anything else. But we're going to take a short break right now. And after the break, we're going to come back and talk about how I, as a chiropractic doctor, am considered a primary care professional for spinal health and well-being, and what I do in the office as a chiropractic doctor to help you get well and feel better. I'm Dr. Donald DeFabio, and we'll be right back. I'm Dr. Donald DeFabio with your wellness tip. A common question that chiropractic doctors are presented with is, does a chiropractic adjustment hurt? Is the procedure painful? My guest is Dr. Joseph D'Angelillo, who's going to answer that question. Dr. D'Angelillo, as a chiropractic doctor, do adjustments hurt?
Like you alluded to before, Don, the most common question that a patient will ask if they've never had a chiropractic adjustment is, does the adjustment hurt? And for the vast majority of patients, the term is absolutely not. It does not hurt. Most patients after an adjustment say they feel tremendous relief and they become energized. Let's talk about what chiropractors are adjusting. It's called a subluxation. And when a joint becomes subluxated, a lot of things take place. The joint is not going to be moving right. Sometimes it's stuck, which we call a fixation. When a joint becomes fixated, there's lots of inflammation that occurs around the joint. The capsular ligaments and the ligaments around the joint will become sensitive and tender and inflamed. There will be some nerve irritation, and the muscles around the joint will become in spasm.
The whole area is just mad.
The whole area is just mad, absolutely. So when the patient receives an adjustment, they might feel some tenderness because that whole area is inflamed and sensitive and tender. So for those patients that feel that kind of inflammation and sensitivity, we advise them to use some ice afterwards. And as that joint heals and starts functioning better, all that inflammation goes away and the joint doesn't become sensitive anymore. But that's the most common complaint, is they might be a little tender at the joint where they...
But it's not necessarily the adjustment that hurt, it's the fact that they were already inflamed and in pain to begin with.
Absolutely. That's the prime reason they might feel some sensitivity.
So if somebody isn't inflamed and is taking an adjustment, what's it like?
Most patients feel relief because sometimes the joint can be stuck a little bit without causing all that inflammation, and as they relieve that stuck feeling, which we call a fixation, the joint is more freely movable and feels great for the patient. They feel relaxed and energized.
You know, it's interesting. One of my patients happened to say to me, you know, that as a guy, I may not understand it, but getting an adjustment for a woman is like getting your hair and nails done. You just feel better overall.
Absolutely. And it's funny because my wife, after she receives an adjustment, she becomes very mellow and relaxed. And when I get an adjustment, I actually become more energized. So depending on what the patient needs, they may have different responses to an adjustment.
It's all about bringing balance back to the body, isn't it?
Absolutely.
Yeah, that's great. Well, Dr. D'Angelillo, thank you. There you have it. Chiropractic adjustments not only make you feel better, they're safe, it's natural, and it's a good choice for your healthcare needs. I'm Dr. Donald DeFabio. Welcome back to the show. So chiropractic, it's natural, it's safe, no medication, no drugs, and it's all about healthcare, restoring health back to your body. It really makes a lot of sense. However, I'm considered a primary care professional for spinal health and well-being. Well, let's break that down a little bit. Well, we already talked about the spinal health connection. When the spine's balanced and when the spine's healthy, then the nerves coming out of the spine, and remember, only 12 nerves in your body don't come out of your spine at one point or another, the body works better. And if the body works better, you're healthier. So we have spinal health is important. Now, where's the well-being fall in? Well, the well-being falls in because it helps you not only regain your health if you've lost it, but it also helps you maintain your health if you so choose to embrace a lifestyle of wellness or well-being. One of the concepts that people have, and it's really a misconception, is that once you begin chiropractic care, you have to go forever. Well, in fact, that's really a fallacy. A majority of people, once they begin chiropractic, actually discontinue care when they start feeling better. Very few patients continue onto the wellness paradigm where they take adjustments on a regular basis like myself. I get adjusted every 2 weeks for spinal health and overall well-being because I feel better. And I believe in the concept that when my spine's working better, the rest of my body's working better, and I'm healthier and I'll have less dysfunction. I can fight off infections better because my immune system is working better because my nervous system is working better. It makes sense to me. I feel the benefit. However, a majority of people, once they feel their symptoms have gone away, they discontinue care. So that's really a fallacy that you have to keep going. A small percentage of patients do decide to continue, and I hope it is more. I hope I can empower you to make some lifestyle changes now to stay active, to keep your body going in the direction it was going. Look at Jack LaLanne. Jack LaLanne in his 90s was still working out 2 to 4 hours a day. He was eating natural foods. He was juicing his foods. Yes, he spent 4 to 5 hours a day on his health, but it paid off. That's really extreme lifestyle changes. But what are some simple lifestyle changes you can do? Well, let's stop smoking. Let's exercise on a regular basis. Let's eat natural foods. Get enough sleep. Let's take chiropractic adjustments, keep your spine balanced, and help your body heal well. Well, those are lifestyle changes that you can choose to do if you want to embrace a wellness paradigm. If you just want to treat chiropractic care similar to a medical model, when you're in pain, you go. When you're not in pain, you don't go. Hey, that's okay too. That's your choice. And you need to find a doctor that can embrace those choices for you. As a primary care professional, what does that mean? Well, it means I'm a physician. It means chiropractic doctors are licensed as physicians in the state of New Jersey. And we're trained to diagnose your problem. That means we examine you with standard physical examination tests, blood pressure, height, weight, lab tests. If a chiropractic doctor is nutritionally oriented, he may order nutrition tests. Reading MRIs, taking x-rays in our office is very common, or sending out for x-rays. So usual standard diagnostic testing found in the healthcare profession today is what we do as chiropractic doctors. The big difference is our interpretation of that and our integration of that, because we look at the patient as a whole. So consider this slide here. If someone's having back pain, we just don't look at their back. We look at their feet. We look at their knees. We look to see if there's other variables which are aggravating the lower back, creating the problem there. So if your lower back pain is because you have poor support coming from your feet, or if one leg is a quarter or a half an inch shorter than the other leg, well, that's got to be addressed. We can treat the pain in your back all day long, but the underlying cause may be somewhere else. So that's the concept behind chiropractic care, is that whole body approach. Something that does confuse people, however, is needing to return to the chiropractic doctor for treatment. Well, look at it this way. You need to take your chiropractic adjustments just like I need to take your chiropractic adjustments from someone else. I can't adjust my own spine. I can do my exercises, I can do all my stretching, I can eat right, but I still need someone else to adjust my spine for me. So chiropractic is a procedure that needs to be done by someone else. However, what confuses people is, as your physician, I do analyze you, I do diagnose you, I do come up with a treatment plan. However, then I am the one that implements that treatment plan. See, what happens in medicine, you get a prescription to here, go get this at the pharmacy, treat on your own. You get a prescription here, go see this specialist, he'll take care of that. You get a prescription here, go to the physical therapist, they'll treat you over there. So everything's outsourced. Chiropractic, it's all insourced. And by insourcing it, we're able to treat you totally as a person with a condition rather than a condition that's found a person. So don't let that dynamic get in the way. You need to take treatments to resolve your chiropractic problem, and how many depends on you, your activity level, your lifestyle, the state of your condition, the severity of your condition, and the healing power of your body. But what's important is, if you use the analogy, if you have an infection, if you need to take an antibiotic, your doctor will say, here, take this antibiotic, make sure you finish all 12 days of it, and don't stop when you first start feeling better, because then you're not going to get full therapeutic value out of the antibiotic. Guess what? Chiropractic's the same, except you need to see the chiropractic doctor to get your treatments. Take all of your treatments until you've received your full therapeutic benefit, and don't stop when you just start feeling better so it doesn't come back. Same concept. We just deal with it differently, with physical modalities, with our hands, with exercise, and with other procedures to get you well. A little different concept, but that's how it works. The #1 goal in the chiropractic office is to get you back to doing what you want to do, to get rid of your pain, to restore your function. That is our #1 goal. Secondarily, when you start feeling better, I know I'm a huge proponent of corrective exercises to help you stay well. And then we can also ultimately talk about lifestyle changes and wellness if you're on board. If you're not on board, then people just come back when they're in pain again, and that's an acceptable option. You need to decide how you want to be handled with your health care, but what's more important is if you don't understand your options, you can't make an informed decision. Boy, a lot of information. We're almost getting to the point where it's too much, so we're just going to take a step back. We'll let you digest some of that. We're going to take a short break. We're going to go over some exercises right now for the hips and the lower back to help stabilize that lower back. So that's going to be your exercise tip for today. And then when we come back, we'll wrap it all up with the 5 factors of health that you can take home and begin tomorrow. I'm Dr. Donald DeFabio. I'm Dr. Donald DeFabio with your training tip for triathletes. We have us today an Ironman triathlete who originally had back pain, and we were a little concerned on why he was having back pain with his training for an Ironman. Well, Sasha, show us what was happening with your quarter squat. When he did his quarter squat, we were noticing that the hip was dropping and the knee was going in a little bit. He wasn't being able to maintain level hips as he was squatting. That's good. His regular squat was great, but as soon as we single loaded him, the hip was dropping and the knee was rolling in. That became a problem because there was a lack of stability. But how did that happen? Well, run in place for me, please. Running, as you can see, is very linear. Everything goes forward. Let's pretend you're on the bike, okay? So when you're cycling, what happens? As you're cycling, the leg is, again, linear. It's always going forward. That's great. You're never using the side muscles. Turn this way. You're never using these muscles, which send your leg out to the side, which do that. You don't do that when you swim, when you bike, when you run. Very little. That's great. Thanks. So what happens is all the front muscles get really strong, but these muscles don't get strong enough to keep up. Why is that a problem? Because when the hips aren't strong and stable, you get that unleveling, and that's what was happening when he was running, and he didn't even know it, and that was causing irritation to his back. We could give him some standard glute med strengthening exercises, but it wasn't doing the trick. Why? Because he was training 20 to 24 hours a week for an Ironman. So what did we do? We did some glute med strapped monster walks. Great exercise. Make this part of your rehab. Sasha, stand on that for me. What we do is we take exercise tubing and you stand on it. You wrap them up. Hold that one. And you wrap it up over the feet. This is the #1 injury prevention strategy in the NBA for recurrent ankle sprains, by the way. And cross them in the front. And then hand them to me over here. So this is how we strap you up for your glute medius monster walks. Great. Now, in this position, he's going to walk like Frankenstein. Go ahead, walk forward, pushing out, keeping the toes forward. He would do that for about a minute. Turn around, come back towards me. Then he'll walk for a minute with the toes out, engaging different muscles in the glutes. And just stop for 1 second. That's engaging all of the muscles right in through here. Your glute med primarily, but all of your external rotators. A minute straight ahead, a minute turned out. Then you can turn around and he'll do 1 minute with the toes pointed in, walking like that. You want to get a burn for your hips? This will give you a burn for your hips. Good. Turn around and come on back. So very simple, very slow, pushing out the whole time, yet also getting engagement of the glutes and the hips. You can turn around to the front. Strengthening your glute medius muscles are essential for runners, for cyclists, for everybody. I'm going to date myself. Anybody who remembers the actor Walter Brennan that had that hip dropping as he walked, he had glute medius weakness. If you need to really hammer your glute meds and strengthen them up, strapped in glute med walks with tubing is the way to go. I'm Dr. Donald DeFabio. Welcome back to the show. I'm Dr. Donald DeFabio. A lot of information. I hope you're enjoying what we're talking about. It's about empowering you to choose healthcare and to consider a very interesting concept. a concept that if you want to take care of your body, first consider a safe, drugless, non-surgical approach. First, if you can. If you need imminent surgery or medical attention for an emergency, by all means get it done. But if you have the option, consider a safe, drugless, non-invasive procedure first, like chiropractic. Choose that first. If that doesn't work, you always have the option to go on to taking medications or surgical procedures if need be. A different approach, a different philosophy, but if you're looking to improve your health without interfering with its natural healing recuperative powers, and you just want to raise up the body's ability to function and to work better, a concept that may serve you well, a concept that involves chiropractic as your primary care professional. So going back to that statement, identity statement, a chiropractic doctor is a primary care professional, look at these statistics. A 7-year study out in Illinois showed that when a patient used a chiropractic doctor as their primary care professional, they had 85% less medication costs. That's right, 85% less. But that wouldn't surprise you because we don't prescribe medication. Well, what about this? 62% less surgical procedures. Hey, that's pretty good. 59 days less as a patient in the hospital. That's even better. Who likes going to the hospital? And 60 less hospital admissions, 60% less hospital admissions. Those are really heavy stats. If you're a numbers person, I would take those stats. There's been other researchers that have shown that chiropractic care on a regular basis could reduce your annual medical expenses by as much as 43%. Those are pretty good numbers. And with your hard-earned dollars, do you want to just spend them on medical care to spend it? Or do you want to save it by not spending it at all or significantly less? So chiropractic is pretty strong in terms of its research and its effectiveness as well as in its safety. So give that some thought. But what else do we do in the chiropractic office? Or what do we do in the chiropractic office? We haven't even talked about that at all. So what we do is to restore balance of the spine without using drugs or surgery, but with using our hands or instruments to restore spinal movement. Let's take a look at these vertebrae. So these are two vertebrae right in through here. These are the joints of the spine. This is the disc. This is the vertebrae. These are the nerves of the spine. When the spine is moving properly, everything works real well. When the spine jams up, nerves can get pinched or nerves can get stretched. When they're pinched, when they're stretched, they don't work well. My job as a chiropractic doctor is to get that spine to loosen up and to move normally, okay? Then the nerves glide, they don't get pinched and irritated, and the nerve functions wherever those nerves go to, whatever organs and muscles they go to, is improved. That's what we do. But check this out. Research has shown when a joint's locked up, whether it's the spine or anything else, when it's not moving properly, what happens is it slowly deteriorates over time. And as it deteriorates over time, it leads to spinal decay, which is this. The disc wears out, you get this lipping and spurring. Now you start to get compression on the nerve and it's not healthy and viable. Hey, if that's the nerve that goes to your head, maybe you get headaches. If that's the nerve that goes down your leg, maybe you get sciatica. If that's the nerve that goes to your stomach, maybe you get heartburn, agita, and indigestion. So irritation of the nerve will be a huge problem. However, spinal decay is directly related to loss of movement of the spinal vertebrae. Any joint that doesn't move properly will slowly decay like an arthritic joint. That's the importance of taking chiropractic as part of a wellness paradigm. That is why, as a primary care professional for spinal health, it also impacts well-being. But let's face it, people that come in for periodic adjustments like myself every few weeks for well-being and wellness, they're also concerned, they're also interested about eating right, about exercising, about lifestyle choices which are going to enhance their life. So yes, chiropractic is important, but I'll be honest with you. A healthy lifestyle is just that. It's a lifestyle. It's no smoking. It's a very little bit of alcohol. It's a little bit, but not too much caffeine. It's about taking care of yourself and getting enough sleep. If you don't get enough sleep, your body can't heal. And if your body can't heal, it's never going to be well. These are all the factors that you have to embrace if you're looking for a wellness lifestyle. You can use chiropractic for patch and fix care. You can use it for a wellness type of care. And another question that I hear all the time is, does chiropractic treat irritable bowel syndrome or headaches or sinusitis or disc pain or sciatica? Does it treat, you can put anything in there. That's not the right question to ask. The right question to ask is, do you want your condition, your health treated naturally, without surgery, without medication, in a safe manner, in a manner that's nerve-based to look at the overlying cause, by a physician that's going to look at your whole body as one unit that works together as opposed to segmented parts, to look at a way of healing and reinforcing health internally so that you're able to fight off disease, infirmity, infection, and to embrace the concept in Dorland's Medical Dictionary of health: optimum physical, mental, and emotional well-being, not merely the absence of disease and infirmity. That's really the question, because if you want that type of care, choose chiropractic. Find a chiropractic professional that can offer that for you. If that's not the type of care you want, then hey, chiropractic's not for you. So it's not what we treat, it's how you want to be treated. And that is what you really need to understand. Look around you, decide how you want to handle your health and well-being, because that's really ultimately what's important. A lot of information in today's show. I hope you got a grasp for the current identity of chiropractic in 2014. We talked about our roots in 1895, but we also talked about how modern chiropractic is evidence-based. Thomas Edison was quoted as saying, "The doctor of the future will give no medicine, but will interest his patients in the care of the human frame, in diet, and in the cause and prevention of disease." I mean, amazing. The future is now. You have it in your hands. You have it accessible to you right now. If that's what you want, it's not why chiropractic and what is chiropractic, it's why not. I'm Dr. Donald DeFabio. Thanks for tuning in, and we look forward to seeing you on our next show. Have a great day.